Thank you for joining us in The Confident Patient in a New World. I'm your co-host, Beth Myers, founder of 2x2 Health and co-author of The Confident Patient. I welcome you today with my colleague and author, Wendy Benson. While we've historically spoken with members of medical teams, such as physicians, nurse practitioners, and nurses, we are talking today with a member of what could be our expanded healthcare team. Dr. Rana Stino is a dentist here in Chicago, and she sees many patients who have health complications, whether it be high blood pressure, heart disease, diabetes, etc. Many of these pre-existing conditions can also impact dental health. We are so happy to have you as our guest, Dr. Stino. Wendy, I'll let you take it from here.
Thank you so much, Beth. And Dr. Stino, welcome. We're really excited to have you.
Thank you so much for having me.
Absolutely. To start us off, do you want to tell us just a little bit about your practice?
Sure. So I practice at Water Tower Dental Care. It's myself and my partner, Dr. Dan Inesco, and we practice with a wonderful team of patient care coordinators, hygienists, and we're right downtown in the Water Tower. And we take pride in being a very comprehensive dental office. So we like to look at the patient comprehensively and take care of their needs that way.
Great. And, you know, when we work with clients, we often have individuals and their family members who may be trying to help them out. So they might be trying to balance dental health issues with, you know, their overall health. How do you interact with other medical professionals when these types of things come up?
So we like to really stress and emphasize, first and foremost, the importance of oral health to the rest of the body and how important it is to have a healthy mouth, to have a healthy body. We've established a really great relationship with physicians and physical therapists and nutritionists and other healthcare providers in our community. And we have a very team-based approach to treating patients. So when a patient comes into our office and we complete a comprehensive exam, we also look at their medical history. We discuss other healthcare providers that they're seeing. We sit down and meet with them and their family members. And then we also bring in their other healthcare providers on board to look at their dental plan and see where that fits in with their treatment so that we can phase it appropriately. We also now, since COVID, offer a lot of telehealth visits so that patients and healthcare providers and family can communicate with us easily.
That's great. Before COVID, I went with a patient who was having dental work, a lot of dental work. And I went with her, and it was the first time I've gone with a patient to the dentist. And they were so excited to see me and talk to me and make sure like they understood the whole case for this patient and making sure she was on antibiotics or we stopped this medication before they came. I mean, he was like, can I have your card? Because it really was another piece of the puzzle that people don't think about.
Yeah.
And mouth care is so important.
Yes, that's so true. I think, you know, having you as advocates for patients and just communicating that piece of the puzzle is so crucial, and it's so much better for the patient overall.
Yeah. It just, you know, I think more and more, there's just a higher recognition of how important it is to be multidisciplinary and have all the different team members connecting together for the betterment of the patient. And it also makes it easier for the family member who may be supporting the individual. It's just so multifaceted.
Yes, for sure. I mean, even one thing that I think of a patient that we saw a couple of weeks ago who was going through chemo and radiation and talking to her oncologist about, you know, hang on, wait, let me make these fluoride carrier trays for our patient so that she can be prepared and, you know, not have damage caused to her teeth by the chemo and radiation and deal with that after the fact. So she was walking into her medical appointment prepared and knowing how to take care of her teeth ahead of time. And, you know, we would have missed that part if I hadn't communicated with her provider.
And how critically important. I mean, that's one less thing for her to have to worry about going forward. That's one more way that that individual can feel prepared and feel empowered with their own health overall. It's really powerful. So, you know, we often hear about there are certain health conditions that can manifest themselves and be seen first, you know, by a dentist or oral health. Have there been examples when you have noticed something by doing a routine screening that people would not have known about if they hadn't had a visit with you?
Yeah, that's a great question, Wendy. So I feel like dentists are often the first providers to see the early signs of disease in the mouth. So again, it's that critical connection, I think, knowing the importance of a healthy mouth to a healthy body and how the mouth is the gateway into the body. So there are several examples. One example that I can think of, again, from seeing a patient recently, is a lot of acid erosion on her teeth. And asking more and more questions, we realized that patient had an eating disorder. And that's something that she felt very ashamed and very embarrassed to talk about, but we were able to have that conversation in the dental office from just seeing signs of wear on her teeth. When a new patient comes in, or even any patient during a regular recare exam, we not only look in their mouth, but we're conducting a really thorough exam. So everything from a head and neck exam, feeling their lymph nodes, their glands, all the muscles in their head and neck. We look in their mouth and look at their soft tissue, their tongue, looking at the back of their throat. So also screening patients' airways, where often we'll see really restricted airways, and we'll ask patients more questions like, wow, we noticed you have a restricted airway and you have, you know, low salivary flow in your mouth. Are you tired during the day? Any history of sleep apnea? And a lot of patients have undiagnosed sleep disorders. So we have them follow up on that, you know, get a sleep study done. Another thing also that I think is interesting to know is patients that may be at a higher risk of heart disease. So when patients tend to build up a little bit more tartar or calculus inside their mouth. So if you have any plaque, it's a thin biofilm on your teeth, but if it becomes calcified, that's where the pH in your mouth can't really manage. It becomes too alkaline, and there's poor management of calcium in the body. So you tend to have more calcium deposits on the teeth. And that could be a sign that your body can't manage calcium deposits in your heart or even in your kidney. So those are all interesting things that we see on a daily basis in the office.
Wow. It's a lot of really good information, and it's motivating for all of us to make sure we stay on top of this, right?
Really not my favorite day when I go to the dentist.
It's good to check it off the list.
Yes.
So we work, you know, a lot of our viewers and a lot of our clients are parents.
Yeah.
And when they have children that are feeling a little bit nervous or have a little bit of anxiety about doing their dental appointments, what message do you share with them to help them prepare?
So, I mean, I know even with my own children, you know, I have to bribe them and give them lots of, you know, treats, not sugary treats, but
different treats.
Different treats from the treasure chest, toys, to lure them into coming into the office. But a lot of positive reinforcement is critical. The American Academy of Pediatric Dentistry does recommend that every child have their first dental visit by the time they're 1 or 2 years old. Dental decay is actually the number one most common chronic childhood disease. And when it's left untreated, it can cause a lot of damage, you know, pain, poor self-esteem, problems with eating and chewing and even speech. So, you know, making it a pleasurable experience at an early age is crucial. And during that appointment, when you bring your child in, it's also an opportunity to establish good discussion, you know, with the dentist about establishing good routines at home. So how to take care of their teeth at home, good diet, and just managing it that way.
Great. You know, obviously with COVID-19, the last number of months, some things have kind of been pushed to the side. And a concern that many people have is, are dentist appointments one of the things that aren't the top of people's list to get taken care of? when you have, patients, family members who are nervous about making those regular appointments and keeping those regular appointments, what advice do you give in those situations?
So I completely understand how, anybody would be nervous about visiting the dentist right now, especially that there's a lot of aerosols and, it seems like a high risk area to be, but you have to look at the risk and benefit of every situation. Having a mouth where there's gum disease or active decay, that's all an active infection in your mouth. And anytime you have an infection in your mouth, your body is working extra hard to fight that infection. So you're actually going to be a lot less resistant to fighting any potential virus that's out there. And actually gum disease has been linked to a lot of respiratory viruses. So gum disease has been linked to pneumonia. And a lot of newer studies right now have shown that the same bacteria that causes gum disease has been found in patients' lungs that have suffered from COVID. So it really is a critical time to make sure that your mouth is healthy. And if you're unable to visit, the dentist at this time, I would just highly encourage good home care, making sure that you're flossing, that you're brushing, that you're even supplementing. So things like vitamin C, vitamin D, zinc. But, it is important to visit the dentist and get rid of, especially tartar that builds up on the teeth. When it becomes calcified, you can brush and floss 10 times a day. You can't get it off. And that's a trigger for that inflammation in the mouth. So I would highly encourage everybody to keep up with their dental visits.
Yeah. Have you, when you work with somebody who maybe has a child or a family member that has special needs, how do you handle that? It's already a visit that some people don't look forward to, right? And so how do you help people prepare when somebody might need some extra assistance with their dental needs?
So just making sure that we have lots of time for patients that may need, some that may have special needs, making sure that we answer all their questions, making sure that they feel comfortable, developing good rapport with that patient, asking the right questions. It's a hard environment to be in, especially if you've had, a bad experience in the past, or if you have anxiety, or if you just feel vulnerable in that environment. But, we make sure that we keep it really comfortable for patients. In our office, we have flat screen TVs on top of every chair, so it's a good distraction. So that's helped a lot, especially, children that may have more special needs and need a little extra distraction. That has helped.
Yeah. I can see how that would be really helpful,
yeah.
Probably for all of us,
Yeah.
No matter what age we are. Sometimes a healthy distraction
can just very true.
It can help smooth it out.
Yeah.
Have you, tell me about a silver lining or two that you've experienced during COVID-19?
Well, it's obviously been a very stressful time from just, we've all gone through, losing control of a lot of normalcy in our lives.
Right.
But from a personal level, having the opportunity to spend just so much uninterrupted time with my family that I never would have had this time before, given myself permission to have this time, that's been wonderful. Professionally, it gave us an opportunity in the office to do some housekeeping and remodeling and change the HVAC system, and also an opportunity to do a lot of continuing education courses. That's been great. I don't think I would have ever had this opportunity to take so many courses online, through Zoom in such a short period of time. So those have all been some great positives.
And how motivating to be able to continue to grow professionally in times that are just so different than they were a year ago, right?
That's so true. That's so true.
Well, thank you so much for your time, Dr. Stino. This has just been just a great exchange of information, and it's going to help motivate me to make sure that make sure I stay on my regular schedule. And I just think this is such helpful information that we can all use. Thank you.
It's my pleasure. Thank you so much, Wendy and Beth, for having me.
Yeah, of course. Thank you, Dr. Rana Stino, dentist at Water Tower Dental Care. If you'd like to connect with Dr. Stino, visit watertowerdentalcare.com or call her office at 312-787-2131. In the meantime, be sure to check back with us as Wendy and I continue our conversations with medical experts as we help the confident patient in a new world. We wish you great confidence and health.
Thank you.